Dr. Nathaniel Anderson is a assistant professor of translational neuroscience at the Mind Research Network. His research focuses on fundamental neurocognitive abnormalities that promote risky, maladaptive behavior. He is interested in behavioral manifestations of violence and impulsivity, substance use disorders, and externalizing traits, as well as psychopathic personality traits and antisocial behavior. Hey, Nate, thanks for being here.
Yeah, thanks for having me.
So what is a psychopath? There are various traits, right? Impulsivity, deception, manipulation, charm, things like that, right?
hmm Yeah, it's part of why it's so interesting to study is that it's a really complex personality disorder. The tools that we use to diagnose it and the way that academia really references psychopathic traits really refers to about 20 different characteristics that we're interested in. So you can imagine even among psychopaths, not all psychopaths are exactly alike. So we're studying exactly like you said, things like narcissism and other traits like boldness and impulsivity, and we're looking at behaviors that are antisocial, criminal behavior, interpersonal manipulation. We're referring to a collection of about 20 different personality traits, and to the degree that an individual exhibits a high enough level of all of these traits, and those traits are exhibited across the lifespan and in multiple domains of their life, then that's when we're really getting into sort of the clinical realm of psychopathy. But any one individual might, exhibit individual traits, and I think it's pretty common for us when we start first learning about psychopathy to recognize, like, oh, I have a friend or a relative or a boss, that exhibits some of these traits, and that's normal for individuals to have some of those traits. But if those traits occur at a very high level across multiple domains of their life, then it becomes problematic.
So it sounds like what you're saying is somebody's not either a psychopath or they're not. There might not be some like sharp dividing line. It's more of like a scale where like most people are probably gonna score pretty low on like I don't know if the PCLR is like the normal test, but then there's gonna be some people who score 30. I think is what we consider, most people consider to be a psychopath, 30 out of 40 on the test. But there's going to be people who, maybe some CEOs or something like that, who might score like a 20 or like a 22 or something like that. And it's like, technically they're not a psychopath, but they do have some strong psychopathic traits, right?
Yeah. There's a bit of a division in how we talk about it, because certainly sort of in the research realm, we're interested in dimensional traits. So these sort of artificial diagnostic cutoffs aren't quite as relevant when we're looking at things like how these traits relate to the brain, because exhibiting some of these traits at medium levels or high levels, those are all relevant to study. But from a clinical perspective, if you need to diagnose psychopathy for like a forensic setting or something like that, then we're forced into a situation where we have to implement a cutoff. And the traditional cutoff is a score of 30 or higher on what still ends up being the gold standard diagnostic tool for psychopathy, the Hare psychopathy checklist.
I remember I was talking to somebody about her ex-boyfriend, she said, was a sociopath, And when I went to kind of reiterate what she had said, I used the word psychopath. And she
Mhm.
said, well, he's not a psychopath. I said he was a sociopath. And I said, what do you think the difference is between those two?
Yeah.
And she said, well, I mean, he's not like a murderer. I mean, he didn't like beat me up. And I said, oh yeah, well, actually, I don't think there's like really a technical difference between a psychopath and a sociopath. I think people just kind of throw those words around, and they just kind of use like sociopath as like a lighter version of psychopath. Is that right?
Yeah, so I avoid the term sociopath altogether for exactly the reasons that you brought up, because a lot of people have different ideas about what a sociopath is. There's kind of an interesting history to the difference between psychopaths and sociopaths, but uh, in terms of academic references, people have largely gone towards just psychopathic traits. You don't see sociopathy a lot in the literature. The term sociopathy originally made a distinction between the same types of traits that we're interested in psychopathy, but it came at a time when we were very interested in sort of nature versus nurture. And sociopathy was really intended to designate the origin of psychopathic personality traits coming from an impoverished environment or poor parenting, definitely more on sort of the nurture side of things. And then psychopathy was reserved for acquiring these traits or having these traits from an idiopathic origin. So things that were sort of inborn, regardless of even adequate parenting and a decent social environment. As we started to recognize in the field that it's never nature or nurture, that it's always sort of a combination of both, that distinction became less and less relevant. And the terminology really just started to migrate towards using the term psychopathy universally. But now, yeah, you get a lot of people referring to these distinctions between sociopathy and psychopathy, with sociopathy being sort of a lower version of psychopathy, or there are a lot of other ways that people use the term, but it's really hard to know exactly what they're talking about. So I kind of avoid the term sociopathy on the whole.
Yeah. And then, well, in terms of like childhood, I had always thought that, psychopaths, they must have had, I guess they were, Ted Bundy or, Jeffrey Dahmer were, must have been abused and all that. Actually, I looked it up, and Ted Bundy had a good childhood. I think the same was true of Jeffrey Dahmer. And, if you think about it, it makes sense, because lots of people have bad childhoods and
Yeah.
they don't become psychopaths, or they don't become violent. So it would make sense that like there would need to be something else there besides just, bad parenting or something.
Yeah, absolutely. There, again, yeah, it's never just one or the other. It's always sort of a combination. When you think of sort of the biopsychosocial model of psychology and mental illness in general, you've got certain vulnerabilities that are going to go, all the way back to genetics. And you might have certain, genetic vulnerabilities that, given a bad environment, end up developing into psychopathic personality traits. But if some of these genetic vulnerabilities are strong enough, even given a great background with great parents, sometimes people still develop these traits. So it's never just one or the other.
Well, now, if somebody's got the genetic traits, and then they have a bad background, I would imagine, okay, that psychopath is going to be more likely to be, let's say, a criminal. If somebody's got the traits and they have good parenting, isn't that person maybe more likely to be a psychopath who's successful? Maybe they're like a lawyer or something.
Yeah, the criminality aspect of psychopathy is its own topic. We could probably talk just about that for this whole interview. But some people consider overt antisocial behavior, meaning, criminal behavior, to be a very important part of defining psychopathy. But again, these are definitions that we've sort of come up with and agreed on as an academic field over time, but they're ultimately artificial. So I like to just get to the heart of what somebody's really interested in, and if they want to talk about successful psychopaths who have a lot of psychopathic traits, but haven't committed serious crimes or haven't been caught for committing serious crimes, that's certainly possible. Because hanging a definition of psychopathy on criminal behavior really depends on the laws that we have and enforcement of those laws, and it's something that's totally separate from psychology, really. But that's why I like to refer to antisocial behavior rather than criminality per se. Antisocial behavior really is intended to describe somebody who is not socially integrated in a way that we expect people to be in a well-functioning society. So somebody who's very self-interested, somebody who is willing to harm others for their own benefit, those types of things are antisocial, and the way that they end up becoming criminal behavior is because they get caught for doing things that are against the law.
So it sounds like you're interested in a certain type of psychopath. I know that in the diagnostic statistical manual, the manual that clinicians would use to diagnose their patients, psychopathy, there's no such thing as a diagnosis of a psychopath. There is antisocial personality. What is it? Antisocial personality disorder.
Yep.
And isn't there an issue with there's an overlap between psychopathy and antisocial personality disorder, but the overlap's not that great. And so isn't there an issue of this is why people think that psychopaths are violent, is because it's like 75% of prisoners have antisocial personality disorder, but only up to like 25% of prisoners are psychopaths. Is that right?
Yeah, and 25% is a generous estimate. Some estimates are as low as 15%.
Most psychopaths are not violent, correct?
Yeah, so that's another interesting question. So the way that I like to think about that, well, and maybe before I get there, just to sort of underscore what you already said, with antisocial personality disorder, it's a bit of a contentious thing in the field, mostly because the diagnostic criteria for antisocial personality disorder are less stringent. It's just easier to meet criteria for a diagnosis of antisocial personality disorder, but the DSM does actually designate some subcategories of things that are indicative of sort of full-fledged psychopathy, but they're really just sort of in the notes under antisocial personality disorder. So there's been a big push from psychopathy researchers and people who are really sort of deep in the field for making those distinctions more specific in the diagnostic manual, but it's an ongoing thing. Yeah, to get back to the issue of violence, there are a couple of things going on there. So, violence is not one of the criteria for diagnosing psychopathy, even, using the psychopathy checklist. The items in the checklist that we're really looking for that overlap with something like violence really have to do with like poor behavioral controls and impulsivity and other traits like that depending on how they're manifested end up presenting as violent behavior. Certainly, I think the more fundamental element there is somebody who's essentially willing to harm somebody else for their own benefit. And that harm doesn't necessarily need to be physical. You can harm somebody in a lot of different ways, but you're essentially disregarding the rights and the feelings of other people in order to achieve goals for your own gain. One of the reasons that violence ends up being kind of a prevalent thing, especially studying psychopaths in prison, is because committing physical acts of violence is a good way to end up in prison. And so most of the psychopaths that we study in prison are violent, but that's not to say that violence is an essential part of psychopathy. And even going back to the original case studies, so again, take a little bit of a history lesson here. The field of psychopathy owes a lot to Hervey Kleckley, who wrote The Mask of Sanity. And he outlined a lot of case studies of individuals that really typified a lot of the characteristics that we're interested in. And if you look at those case studies, most of those people were not violent people. So it's been said that violence is more of the exception than the rule when it comes to psychopathy. But certainly studying psychopaths in prisons, we do see quite a lot of violent behavior.
Cleckley was fascinating. He was in like a psychiatric ward, and he's seen all these kind of crazy patients and walk around, and he spots a few who they don't seem to have anything wrong with them. And it wasn't until he looked closer he sees. They're charming. Everybody, people like them. They just seem to be like normal people, but they're patients. And, like I said, it wasn't until he looked closer that he sees that they're like compulsive liars and they're, manipulating the staff. And it was really interesting.
Yeah. And that really is how the academic topic, blossomed into its own field. But it took a lot of time. But psychopathy is something that has been represented in sort of all cultures throughout history in one way or another. People have described this in different ways, but these traits tend to run together in certain individuals that people ultimately recognize as being sort of dangerous, manipulative, and really being a detriment to themselves and people around them.
Let's look at some of those traits. So one of them would be a lack of empathy, which would, kind of lead one to, possibly harm somebody. So is it true that psychopaths lack all empathy?
The short answer is no. And the reason for that is even a construct like empathy is kind of a heterogeneous construct. So you have what's called emotional empathy, which is what people generally think of when they think of empathy. And this is the idea of sort of feeling the way other people feel. If you see somebody who's sad or in pain in some way that affects you in an emotional way, and you not only recognize that emotion, but there's sort of a mirroring effect there too. And so that's the emotional side of empathy, but there's also cognitive empathy, which is another way to describe that is theory of mind. And that's essentially sort of being able to recognize and identify, what the state that somebody else is in. So, or knowing essentially what's in their head, what they know. So cognitive empathy is generally intact in psychopaths. And this is pretty easy to recognize if you look at any individual psychopath. It's not that they can't identify emotions. They can certainly point to somebody and say, that person is sad, that person is happy. So they're not lacking empathy altogether. But where that deficit becomes apparent is when those emotional responses that are reflected in our own emotional centers in our brain, those end up not impacting their behavior in the same way. So most of us guide our behavior in certain ways that are influenced by our emotional responses, and those just aren't as salient in people that have problems with the emotional side of empathy.
So they don't have the emotional side, but they can read in people. Maybe there's something called, I think, the psychopathic stare. Maybe that's why they're staring at people and not blinking. They're reading on you what your emotions probably are, so that they can manipulate you often, right?
Yeah. One example I like to use when I talk about this is like, you can imagine yourself at work, and maybe you're in a hurry to go get lunch and get back before you have a meeting or something. But on the way out of the office, you might see a coworker who's obviously upset or crying or something like that. And there are a range of responses that we might have to that. One person might recognize that, and it essentially changes their plans, changes their prioritization, and they may decide to spend time with that person, whatever. Another person might see the same thing happening, and maybe they don't know the person very well. They might sort of casually check in, say, hey, is everything okay? But you might make the estimation that, well, one of their better friends is going to intervene in this situation. It's not really my place. And that's not really a callous response. It's recognizing, so it's still having the empathic response, and somewhat changing, your priorities in terms of how hurried you are in your behavior, but you ultimately make the same decision. You're not ignoring them. Where what a psychopath might do is they might see the emotion, recognize it, and then decide, oh, this is a good opportunity for me to manipulate this person. Maybe I'll invite them out to lunch, and I can get them to pay for my lunch by spending time with them. And so rather than being sort of impacted by whatever emotion you're seeing in that other person, they recognize it, but they're really using that information for their own gain.
So it sounds like there's sort of a necessary connection between what you're describing as a as a psychopath and narcissism.
Mm-hmm. Yeah, narcissism is something that comes up a lot. It's not specifically identified in like the 20 different traits on the psychopathy checklist, but it's certainly there are a lot of different ways to sort of model psychopathy. And if you are modeling psychopathy with like some of the other personality factors that we're usually interested in, narcissism is one of the ones that comes up a lot. Yeah.
So we're going to imagine this psychopath as very narcissistic. He's going to manipulate people for his own gain. I say he, we think of psychopaths are probably males. I'm sure a lot of them are female too, but
we study both. Yeah, we study psychopathy in men and women. Yeah.
It probably more men than women, I'm guessing. Although
Yeah,
probably a lot of women probably get misdiagnosed more, I would assume, as like being histrionic or something.
yeah, there's again, it's sort of some of the limitations of the measurement tools that we use. So it's not necessarily that women certainly can meet full criteria for psychopathy, and we have a lot of research subjects who are women who fall into that category. But by averages, women tend to score in prisons. Women tend to score, I'd say, probably 6 or 7 points lower on psychopathy than men do. And then those cutoffs that we talk about are those are really were originally established based on like the standard deviation from the average in a certain population. So what some people will do if they're studying psychopathy in women is they'll just move that bar to be more consistent with a like a standard deviation away from the mean. And you see that in when you're studying psychopathy in other countries too. So people tend to score higher on these traits in the United States than they do in, say, Canada. And so if you're trying to designate a cutoff in Canada, you might move that bar from 30 down to 25.
Okay.
But again, it's sort of an artificial distinction. You're really talking about dimensional traits here. So so these aren't laws of the universe. They're just things that you're trying to get people to agree to.
So Americans are psychopathic, is what you're saying. What about the lying part? I try to imagine being a psychopath, okay, because I know about the traits, somebody who's callous, bold, at least one type of what you might call the classic psychopath, impulsive, bold, manipulative, narcissistic, thrill-seeking, sexual promiscuity a lot of times. And I try to imagine that person as being honest. This person's not a compulsive liar. Is that a thing?
Yeah. So pathological lying, is one of the explicit criteria on the Hare checklist. And that's not to say that they're incapable of honesty. From my experience giving interviews with psychopaths, there is sometimes kind of a refreshing degree of candor in their interviews, and that is influenced maybe by their sort of imperviousness to embarrassment. There's really no shame, in the way that they express themselves, and so they're usually very forthcoming, when talking about some of their more disreputable traits and things that they've done. But where lying comes in is always in terms of manipulation, in terms of like achieving a certain goal. So pathological lying ends up being really an important part of it. And this has to do with sort of stretching the truth. It overlaps a little bit with grandiosity and narcissism. They'll often exaggerate things to sort of build themselves up, make themselves seem very impressive. They see themselves as more important than other people. So there's some of that in there with the lying, but there's also some thrill seeking to it. So there's something that people will refer to as like duping delight, where they might just lie for no reason because it's kind of exciting for them, because they're trying to sort of see what they can get away with or what they can get you to believe about them. But again, that doesn't mean that they're dishonest in all circumstances. It can just be difficult to distinguish between when they're being honest and when they're not being honest. Yeah.
Okay, so what about the person at home who's diagnosing themselves right now? If you think I think I read somewhere, it was like, if you think that you might be a psychopath, you probably aren't.
Yeah, yeah, that's I haven't heard that, but that's
Well, the
pretty
idea is that like psychopaths aren't really into like deep reflection. They're not really into like, I wonder
right.
if I'm this way or that way.
There's not a lot of introspection there. Yeah.
By the
Um,
way, I don't know if you were going to say there, but I had a buddy of mine. One of my buddies he's fascinating. He's one of the most likable people I've ever met. Everybody who meets this guy likes him. He's in sales. Okay. He is known, and all of his friends know he's a compulsive liar. He lies all the time. We still like him. You catch him in a lie. The thing is, I caught him in a lie once. He said to me, I told him I was at the sushi place in Denver last night.
Yeah.
And he goes, I was at that sushi place last night. And I said, wait a second. An hour ago, you told me that last night you were in San Francisco.
Right.
And he looked at me and just smirked and walked away. And everybody knows what a liar he is. And so one day, to kind of mess with them, we were playing pool, and I said, hey, I'm studying psychopathy. And he goes, what's that? And I start telling him all the traits.
Yeah. Yeah.
And he stops for a second, and he looks at me and he goes, I might be a psychopath. And then this quick, he turns and does his pool shot. And it was like nothing happened.
Yeah. 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 There's some similarities with things I've seen in interviews where sometimes, these, we work with a lot of inmates who are volunteering for research. And we study all kinds of different things, not just psychopathy, but maybe somebody has read some of our work, or they've seen something on the news, and so they might ask us, I heard you guys are studying psychopaths, or is that what you think I am? And sometimes we just talk to them about the different personality traits that are definitive of what we call psychopathy, and we'll sort of list some of these off, and some of them are like, oh yeah, that's me. But again, the very sort of high scoring psychopaths, I think, are not so introspective that they would really be concerned about that or put much thought into it.
Now, in terms of treatment, so first off, in order to have a problem, a diagnosable problem, right? There has to be like an impairment. And so if somebody's, I'm trying to remember, Alan Francis was, he's a psychiatrist. Somebody asked him whether Donald Trump suffers from narcissistic personality disorder. And Alan Francis said, well, he's certainly a narcissist, but in order to have a disorder, it has to be getting in the way of your life. And I mean, after all, the guy became president. Like it doesn't seem to be like disrupting his life. It may be disrupting the people around him, but just because somebody's a narcissist, it doesn't mean that they have narcissistic personality disorder. And so maybe you say the same about psychopaths, where if somebody's psychopathic, but they're living this great life, they probably won't go to treatment. And maybe they don't need it. Actually, I'm pulling up a quote. Paul Bloom over at Yale said something I thought was great. He said that, let's see. He said, it would be unusual for someone like James Bond, the ultimate psychopath, to seek therapy for his guilt-free life of sexual promiscuity and adventure.
Yeah, I certainly that comes into the discussion a lot when we're talking about like treating psychopaths, or what is the purpose of the research, right? Because all of this is really intended to be translational in some way to improving people's lives. And that's one of the barriers to treatment with psychopaths is, unlike other disorders, they're usually not recognizing these things as problematic. They see themselves as sort of better than other people. They recognize they don't play by the same rules, but they, don't want to lower themselves to become more like everybody around them. They see themselves as superior, and so for that reason, it's they're not treatment seeking. They wouldn't be motivated to enter into sort of a therapeutic setting to try to change their personality to make them more normal.
They probably mostly go to therapy when it's like mandated by the court, I would assume.
Yeah.
Or it's going to get them some benefit.
Yeah. And there's even some old research showing, and this is it's older research and it hasn't been replicated. It's kind of controversial, but it ends up getting cited over and over and over again because of the implications of it, which and what happened was they were looking at recidivism and therapeutic intervention while people were in prison. And what they recognized was that psychopaths who engaged in group therapy were more likely to reoffend than those who didn't. And so, and some of the interpretation of this was that what they really got out of group therapy was more insight into other people's vulnerabilities, and it sort of gave them more equipment to use to manipulate people and to recognize things that they could use in order to be themselves. So
made them better psychopaths.
Sure, yeah, that's one way to look at it. I certainly don't want to use that as an excuse for not looking at how we can sort of intervene in better ways. And so as long as we're on the topic of intervention with psychopathy, I think it's important to say some of what we're doing in the neuroscience realm is to recognize what's going on in the brain and how that manifests itself developmentally. I think certainly treating psychopaths as adults has a lot of difficulty, a lot of obstacles, but a big focus of our translational research is to look at intervention in young kids. And so when they're exhibiting some of these traits and showing some risk factors that might be recognized as developing into full-fledged psychopathy, there are things that we can do at different developmental stages that might prevent somebody from really harming themselves, harming others, in the way that you see when you study adult psychopaths.
Interesting. So where are you getting these kids to? So you're like getting these kids and you're putting them in like brain scans and then seeing if they meet criteria to get some kind of therapy or drugs? What's going on there?
Like, to generally describe all of our research, we're looking at a lot of different personality traits that overlap with psychopathy. Adolescents and kids, they can't be diagnosed with psychopathy. That's a sort of a diagnosis that's reserved for adults. But in kids, sort of the corollary of antisocial personality disorder in kids is conduct disorder and juvenile delinquency and things like that. So in our research with kids, we study kids who are in juvenile treatment centers, and essentially they've been convicted of crimes and they're incarcerated, and they volunteer for our research just like adults do, along with their parental representatives, and we look at all the same things. We look at how their brains differ and how differences in their brains correlate with the personality traits that we're interested in, and we also study these things longitudinally. So we will engage with a research subject for years. We start the research process by assessing all these traits and scanning their brain and doing, many other types of psychological testing. But we ultimately are looking at how their brain changes over time, and if they're engaged in a particular type of therapy or treatment program, how that influences those changes over time. One of the more successful programs that we work with, they have a really unique treatment program that puts a lot more emphasis on sort of psychological intervention and therapy, and a lot of reward-based motivations for behaving in the way that we want people to behave. And so these treatment programs have been really successful in kids, and tend to reduce recidivism and reduce development of psychopathic personality traits as adults. So there's a lot of opportunity there for good interventions, but we're still learning.
How do the brains of psychopaths differ from the brains of non-psychopaths?
The classic answer to that has a lot to do with the limbic system, which is engaged in a lot of the emotional processing in the brain. So, but more than that, the limbic system really encompasses a lot of different regions of the brain that are involved in emotional processing and attention, and also behavioral control and things like that. So some of the early research really focused on the amygdala. Amygdala is sort of classically involved in threat detection and fear responses and things like that. And the theory, and this is still probably the predominant theory, was that impairments in amygdala function essentially reduced the salience of negative environmental stimuli, so things that are punishing to you or things that you recognize as being potential threats. They end up not influencing your behavior in the same way that a healthy individual is influenced. So you and I might experience punishment or get into a situation that we learn from, and we tend to recognize some of those same cues as being potentially threatening or punishing or harmful to us, and we adjust our behavior because of that. But if the amygdala isn't working properly, or is even just quieted down with respect to its response to those types of environmental stimuli, then that learning process doesn't happen as efficiently at a cellular level. So that was part of the explanation that people were really putting forward for why psychopaths don't learn from punishment very well, and they don't anticipate negative consequences of their behavior very well. But it gets even more complicated and interesting than that, because other sort of competing theories really focus on attention more than emotional processing. And in those models, attention is kind of a more fundamental process, in that things that are emotionally salient to us, things like reward and punishment, that's one version of attention. That's we recognize things that are potentially rewarding and punishing, and we devote more cognitive resources to those things because it's adaptive for our safety and survival. So attention is kind of even a more fundamental level. And there's some great work that was really pioneered by one of my heroes in the field, Joe Newman, and he and his students and people that have come up underneath him have really developed some interesting theories about how attention works in the brain of psychopaths. And that tends to suggest that what psychopaths really have a problem with is diverting their attention to new and potentially relevant information. So the way that this makes sense on a phenomenological level to most people is that if you get somebody that's very hyper focused on kind of a particular goal, psychopaths are very goal oriented in that respect, and that they sort of have a goal and they'll sort of do whatever it takes to get that thing that they want. But the influence of potentially punishing circumstances and all that, those are things that we normally flexibly integrate into our cognitive processing, and psychopaths just don't pick up on that information very well. They're kind of hyper focused in that way.
Okay, so they're bad at learning, but it seems like a flip side of that, having that dimmed down fear, is that they become bold and kind of, some of them are fearless dominant. I remember the study that they did of past presidents, and you see a lot of psychopathic traits in presidents, especially fearless dominance. Teddy Roosevelt, Bill Clinton, John F. Kennedy was a big one. Lyndon Johnson, I think, scored the highest. But you know, when I talk to people who jump out of planes or do certain just crazy things I could never imagine doing, sometimes I think like, yeah, there's maybe something wrong with this person. But in another sense, like, that's amazing that they can, you know, do these fearless kind of things.
Yeah, and so that type of fearlessness is a little bit different so the type of fear processing that we talk about with psychopaths really happens at a very local level. And what I mean by this is, like, you and I are having this conversation, we're paying attention to each other, we're devoting most of our cognitive resources right here. But if, you know, a door slammed over here, or I noticed a snake scurrying by, you know, my attention would be captured by that automatically. And my brain would automatically divert resources from here, and I'd be distracted from our conversation and have to, you know, deal with whatever's happening that might be dangerous for me in my environment. And at that level, you know, that's an attention thing more than it is a fear processing thing per se. So so that's why I bring up the attention stuff. When you get into talking about like physical risk taking, certainly there are individual differences there where you recognize that some people are just more reckless, or, you know, not as fearful for their own physical safety. But a lot of these, you know, thrill seekers and people that do extreme sports and things like that, I would say that they are almost the opposite of psychopaths, in that most of those people are really engaged in a really serious evaluation of their own skill level and how that relates to their own safety and survival. So it's not necessarily that they're being reckless or fearless. It's that their fear is, you know, at a different level than a normal person's fear in that circumstance, because they're highly skilled at something, or they have a lot of experience in that realm. But it's not exactly the same thing as the kind of fundamental fear processing and attention driven differences that we're interested in when we're talking about psychopaths.
Okay, so if they were psychopathic, that they would be more, you would expect them to be more reckless and irresponsible. I do want to get into it though, in a little bit though, about, you do see, you know, in terms of the most psychopathic jobs, they do come up a lot in terms of like military or police, or being a surgeon. I mean, something I'd be terrified to work on a patient or something, but we can come back to that in a second, because I wanted to ask
Sure.
you, So is the psychopath less likely to notice the door or the snake?
Yeah, I mean, especially if it's, so if you, in an experimental setting, what's interesting about this is in very simple environments, they process those things just fine. It's kind of like when I mentioned the empathy thing, where it's not as if they can't identify when somebody else is sad. It just doesn't have an emotional impact on them in the same way that you and I might sort of have that emotion reflected in us, and it ends up influencing our cognition and our behavior. With fear processing, it's not that they can't identify things that are potentially threatening if you give them a very simple task. But the way that you recognize these differences is you have them do a primary task that has peripheral sort of distractors or things like that that are sort of built into that task. And so in a sufficiently complex environment, something that's more like the world that we live in, when they're engaged in a primary task, they have much more difficulty integrating emotional cues that might influence their performance on that task. And so there are a lot of different experimental paradigms that sort of capitalize on this, but that's the nuts and bolts of it, is that in a sufficiently complex environment where they have one particular goal, but other information comes in that might be relevant to that, they don't process emotional information under those circumstances as well.
Okay. Interesting. So in terms of, I'm kind of trying to focus more on the, in a way, positive. I'm trying to give more of a positive pushback, just simply because when people think of psychopaths, people are familiar with what they would call it a negative thing.
Yeah.
And I find it fascinating to think about how great it can be. But,
yeah, the positive side of things, that's that's it comes up a lot in the literature too. Some people are very interested in sort of the adaptive side of psychopathy, and I think where people in the field end up getting in little disagreements is what we talked about before, in that if you're really talking about sort of a clinical disorder, these things need to manifest themselves to such a degree, and enough of these traits together that it ends up having some negative consequences in your life. But certainly looking at individual traits like boldness and fearlessness, or however you want to describe that, those types of things can certainly be adaptive in certain contexts, and facilitate progress in careers, or I think some of the evolutionary theory behind it is in terms of sexual reproduction and a tendency to go out and explore and be more bold in terms of exploration. But that's just one small part of all of the different traits that we're interested in psychopathy. So if you combine some of those traits with many of these other traits, like stepping on people to get where you want to be, and impulsivity that might be physically harmful to you in some way, then the combination of those things can end up being negative. But there are positive things to some of the individual traits in certain circumstances.
Yeah. So, like, for example, Teddy Roosevelt, he was extremely fearless and dominant, which a lot of people have talked about. It's associated with psychopathy as fearless dominance. But he wasn't technically a psychopath because he didn't have like the negative side.
All of the traits, right?
Exactly.
Yeah, and that's what I try to emphasize as much as I can when people talk about sort of these positive aspects of it, is looking at the traits individually there can be a lot of positive things associated with some of the traits, but the collection of all the traits together and then elevating those traits to a very high level can be, severely detrimental.
Yeah. Bill Clinton was one of the examples of the, impulsivity. He had that kind of that other side, that reckless impulsivity.
Yeah.
We had talked about Clucky Kleckley before, the pioneering researcher. So he says, many psychopathic individuals seem free from social or emotional impediments, and that everything about them is likely to suggest desirable and superior human qualities, a robust mental health. He claimed that the results of psychiatric examination disclose nothing pathologic. Hare, who I think you mentioned before, the current leading expert on psychopathy, states, if I wasn't studying psychopaths in prison, I'd do it at the stock exchange.
Yeah, that's certainly a good way to think about some of these traits and how they present in different careers and different paths in life, because certainly some of the even things that we think of as being negative, like lying or manipulating people, or a certain degree of impulsivity, some of those things that might be negative in some circumstances might allow you to be to advance in politics or finance or other types of careers.
In terms of the most psychopathic jobs, I pulled up here. Number one job was CEO in the study. Second most popular job was lawyer. Others in the top 10 were salesperson, chef, police officer, clergyman, and surgeon. So it seems like psychopaths tend to gravitate towards positions of power and status.
I haven't heard that list before. I might disagree on the point that so I wouldn't say that psychopaths gravitate towards careers like that, but if you have an individual who has some of these traits, then those traits can be advantageous in a lot of different circumstances. But again, I try to emphasize the pathological consequences of having all of the traits at a very high level, rather than sort of because once you start focusing on just 3 or 4 of the traits, you're not really talking about psychopathy anymore. You're talking about some of the traits that are involved in diagnosing psychopathy.
Okay, so let's talk about psychopathy in terms of let's say statistically you're going to come across one psychopath a day. Seems fair.
Sure. Yeah, I think the rates in the general population are like 1% or under.
So, and if we say that psychopaths are more likely to con or manipulate than to kill you, or to like walk up to you and just beat you up, that seems fair, right? How does one spot a psychopath? Are psychopaths like, do they have some special talent or skill that's like they're better liars than other people, or like why are they so hard to spot? And here's the thing: after hearing what we've been talking about, people are going to start spotting psychopaths. Like they're going to think their friends are all psychopath, their family, they're psychopath. So how do you spot a psychopath? Why are they so hard to spot?
You bring up a good point with, the sort of, there's skill involved in lying, right? Like, and somebody who practices lying all the time is going to get better at lying. And some of that is recognizing, like the friend that you described earlier, getting caught in a lie. Some of that is the process of sort of learning to be a better liar, and what to do when you're caught in a lie. So people that tend to tell the truth don't get a lot of practice at lying, and they're pretty bad at it. But you know, a psychopath who lies all the time and has been doing it his whole life, I think there is a learning element to it. Yeah. Also, you know, other traits like the narcissism and grandiosity and just sort of self-centered approach that psychopaths take towards life. I think sometimes being generous and being you know, kind to other people doesn't always help us immediately. It's so certainly, you know, selfishness and some of those things can, you know, help, and practicing that over and over and over again, you learn where your best advantages are. And if you're solely interested in sort of getting yourself to the top, then you're going to learn by doing it over and over and over again.
How does somebody find out if they're a psychopath besides getting into prison and you studying their brain?
So I think the hair psychopathy checklist, you know, that's still the gold standard diagnostic tool. And it's something that you can look up, but people often talk about, you know, they'll list the 20 traits that are evaluated in the checklist, but it is intended to be an expert rated device. And it takes a lot of practice to learn how to identify these traits in people and really identify them correctly, particularly if you're trying to diagnose somebody or evaluate somebody who's not 100% honest with you. Part of scoring the psychopathy checklist is not just interviewing them, but is looking at collateral information from other sources, like you know, prison records, crimes that they've been committed for, public records, you know, things that can corroborate or sort of let you know if some of the things that you think you've identified in this person as a personality trait, whether that's true or not. And then also looking at that over the course of their life. So is this a trait that has always been present, you know, from the time they were a kid? Psychopathic traits are theoretically, you know, fairly stable over the lifespan. So it's not something that somebody just becomes a psychopath later in life. These are traits that should be evident from an early age, which is why we're interested in early intervention. Yeah, trying to get diagnosed as a psychopath, I think, just like we were saying, if you are sort of trying to self-diagnose, that might mean that's kind of anti-psychopathic because you're showing some degree of introspection and interest in that. But being evaluated by a clinician is really the best way to do it. And engaging in a therapeutic process is also something that most psychopaths aren't really interested in.
So yeah, and so it's not something that you're gonna, so like the checklist, even though you can look it up, and it's really interesting to anybody who hasn't done it, look up the 20 traits. That's interesting. But like I said, once you look up those traits, you are going to start spotting psychopaths everywhere you look. So just a warning. But this is not something that it's not a condition that you diagnose yourself. What last thing, I know you're not a clinician, you're a neuroscientist. Would it surprise you, and I don't want to get political, just would it surprise you if Donald Trump is a psychopath?
Oh man, yeah, that's a pretty loaded question.
Is it okay?
No, I think it's pretty clear. He certainly exhibits some of those traits, right? I think it would be hard for somebody to make the argument that he doesn't have some of those psychopathic personality traits. But when you start getting into the weeds of, you know, how many of the traits that are a little bit harder to identify from like a public person like him. You know, it's not
Mhm.
easy to really professionally identify the level of a lot of the traits. I think people certainly see, you know, some narcissism and grandiosity and willingness
Impulsivity, manipulation,
yeah, manipulation, willingness to lie.
boldness.
Yeah, exactly. So certainly a lot of those traits are, I think, present. But as you mentioned before, you know, he's been successful in the realm of politics, and whether that disqualifies him from being a psychopath or not, you know, that's not really for me to say, because it's again, you know, those distinctions are kind of artificial distinctions that that we have to agree on as a field. They're not laws of the universe, but each of the traits that we recognize as being advantageous in a certain circumstance, like for him, you know, those are worthy things to study in and of themselves. So yeah, that's my politically evasive way to answer that question.
No, that is actually clear. Cool. What do you want to share, or where can people find you?
The best way to find me is probably on Google Scholar. Most of my published work is available directly through links on Google Scholar. Just search my name and psychopathy. But I study a lot of other things besides psychopathy. I'm interested in substance use disorders, and I'm interested in, you know, all kinds of things that sort of happen at higher rates in prison populations. I'm interested in developing different treatment programs in prisons and trying to come up with better solutions to reduce recidivism in our communities. And so, yeah, there's a lot there, and psychopathy is just a small part of it.
Awesome. Thanks, Nate.
Yeah, thank you. This was a fun talk.